research sector in Romania.
Bună ziua, domnule doctor!
Bună ziua!
Bună ziua, bună ziua!
Bună ziua!
Doamnelor și domnilor!
Bună ziua!
I'll say good morning or good afternoon, depending on where you are.
Let's say middle of the day, somehow. We had a speaker previously from US and she was, woke up at 5 a.m. Ștefan, suntem gata pentru live?
Yes, we are live.
Okay. So welcome back to the session regarding view on global COVID-19 vaccination status Romania. I am very honored and happy to have distinguished guests together with me for this very, very, very important topic. Allow me to make a short introduction of our invited guests. So we will have our very, very dear friend, Dr. Marius Geanta. Marius is president and co-founder of Innomed, Center for Innovation, a true pioneer in the field of personalized medicine in Romania and Central Eastern European countries, involved in some pan-European innovative healthcare projects. He has been joining the symposium for many, many years now, and he will moderate the session regarding vaccination campaign. Together with Marius, we have Sibilia Quilici, Executive Director of Vaccines Europe. Sibilia is an innovative and strategic thinker with strong leadership capabilities, creating trustful relationships, setting on European consortium with a multidisciplinary approach and public-private partnerships. We have also His Excellency Mr. David Saranga, the Ambassador of the State of Israel in Romania. He already served at his first posting in 1997 until 2000. He also served for 4 years as the Senior Foreign Affairs Advisor to the President of the State of Israel. And I'm happy to welcome your Ambassador to our meeting and present the situation in Israel. We have also Assist.Prof.Col.Dr.Valeriu Gheorghita, President of Vaccination Campaign in Romania. Dr. Gheorghita graduated in 2006 the University of Medicine and Pharmacy from Târgu Mureș, obtained the title of Doctor in Medical Sciences in 2013, and he works in the field of infectious diseases. And last year in November, he was appointed as President of Vaccination Campaign by the President of Romania. We have also from UK, Dr.Lucio Fumi. Dr. Fumi has worked as Medical Director of International Cooperations to include Baxter, Abbott, Terumo, Bristol Myers Squibb, with pharmaceutical, biotech, clinical nutrition, and medical technology products, having over 30 years experience in the field. And during pandemic, he was involved in drug repurposing projects and in vaccination program in UK. From Romania, also, we have Associate Professor Dr.Simin Aysel Florescu, General Manager of Victor Babeș Hospital Infectious Diseases, doctor with over 20 years of experience in the treatment of infectious and epidemiological diseases. Now she's in the first line of pandemic as infectionist as well as manager of the infectious disease hospital. We have also Dr.Radu Ciprian Tincu, Coordinator Intensive Care Department, Emergency Hospital Floreasca, as well as the rest of you in the first line of pandemic situation. And he is also head of works within the Department of Clinical Toxicology within Carol-Davilao University of Medicine and Pharmacy. And we have, and I hope she has joined, Dr.Sandra Alexiou, President of Bucharest Family Physician Association since 2015, member and communicator of the Immunization Working Group of the National Society on Family Medicine. So welcome all of you. It is a very hot topic, and I give the floor, Marius, because you are a great conductor of this orchestra. Please.
Good afternoon, everybody, and thank you so much, Krista, for inviting me. Indeed, I'm one of the veterans, I think, of the Clinical Trials Symposium in Romania. I don't know, yeah, maybe for 8 or 10 years in a row. And this year, I'm very honored, actually, to be the moderator of this session on COVID-19 vaccination status. And thank you so much for presenting, actually, our speakers. We have 7 speakers in less than 1 hour, so it will be a challenge in terms of staying in time. That's why I'm now moving to invite the first speaker, Sibilia Quilici, the Executive Director of Vaccines Europe, the European Federation of Pharmaceutical Industries and Association, EFPIA. Sibilia will present the current status of COVID-19 vaccination from the Vaccines Europe perspective. Sibilia, the floor is yours.
Thank you. Don't know, for the slides, are you presenting those?
Do you want to share, or could we share the screen? Do you want to share the screen?
I can share if you, I can share, that's fine.
Okay.
You just confirm that you see them.
Yes.
Perfect. I'm just going to put it on full screen. And do you see the full screen?
Not full screen.
Oh, the slideshow. Is it the slideshow? Okay.
Not full screen yet.
So I will put it like this because
Okay.
I've got 2 screens with me, and it would be difficult. So thank you for the invitation to start with. It's really an honor to be a speaker to such a panel. What I've been asked actually to present on COVID-19 vaccination, and the title is Challenges of COVID-19 Vaccination, but with COVID-19 within brackets, because it's also beyond actually just COVID-19 per se. So what I wanted to address with you today, and try to be fast because time is running indeed, is where we are at with COVID-19 vaccination in Europe. Is a bit of snapshot globally, but also in Europe. The impact of COVID-19 actually that it had on routine immunization, which should not be forgotten. Why are we here, and a call to action, but what needs to be done. So briefly, with regards to where we are at worldwide, I think it's quite a tremendous achievement, honestly, considering that we initiated the vaccination less than a year ago. We have over actually half of the population worldwide that actually received a dose of COVID-19. So this is unprecedented. Is not where we should be, because we should be actually at the stage where we should be able to have vaccinated everybody. But in such a short period of time, considering that we have a really good vaccines candidate on the market today, it's a tremendous achievement. When we look at where we are at in Europe, so again, in about 9 months, 10 months now, we have managed to cover 75% of the European population with a full course. So it's not only 1 dose, it's really the full course of vaccination, so 2 doses. But we see actually still disparities across the region. Here are the latest data from the CDC. So we see clearly a separation west and eastern part of Europe, and the eastern part of Europe being the countries that have the most difficulties in having a right uptake for COVID-19 vaccine. And Portugal, Ireland are actually quite the leading countries with regards to the highest uptakes. I think Portugal managed to get close to 99% or 100% of uptake with their COVID-19 vaccination program. Why there is differences? The uptake has happened. It has happened not without a big push from a political side neither, and we will look at that a little bit more in details. But I just want to mention that vaccines and hesitancy remains the main barriers to access to vaccination. It's not new. Vaccine hesitancy has been actually find his first day of birth from the first day of vaccines, basically. So we have vaccinated intensively since the 19th century. But obviously raised even more due to our ability to communicate broadly today through the social media, notably. And what the vaccines confidence, vaccine hesitancy is a complex phenomenon. I mean, we have issues with regards to confidence. So do people have trust in the product that is being delivered, in the health systems that is delivering this product, or in the policymakers themselves that is instructing the policies? Constraints, I prefer the word convenience personally, but just to reflect whether it is easy or not to get vaccinated. Complacency related to whether we feel at risk or not, and basically willing to be vaccinated or not. And complacency is definitely a major matter with regards to adult immunization. There is a calculation, is how do people search for and use information to inform their risk-benefit analysis about vaccination. So source of information here is critical. And there is this collective responsibility. Do we feel motivated to protect the others? So all of this actually are put in the balance, or whether we are going to go for vaccine or vaccination or not, which is multifactorial and quite complex. And when we look at what was going on with regards to the countries, I mean, we've seen it's been all over in the media. We've seen governments taking different approach to ensure uptake with regards to COVID-19 vaccination. Some policies have emerged in countries that did not have those, such as increasing access to vaccination, because it was not enough to go through the general practitioners, and the healthcare system was just basically overloaded with the issue of COVID-19 cases. So increasing access, we had mobile clinics moving around, we had pharmacists that has been engaged with regards to vaccination, notably in Italy. We've seen it as well in Belgium. Countries that did not provide access to vaccination through pharmacists before. And then we have seen mandates coming over, some policies related to mandatory vaccination, notably for healthcare workers. We have seen it in France, we have seen it as well in Italy. And with the arrival of the pass to be able to travel over the summer, some countries took the bold decisions to have green pass to go to restaurants, cinemas, public places that require crowds. And today we see that there is still issues related to reach the right level of protection. We are entering in fourth wave, and some governments are actually getting even more stronger with regards to their policies. I think the most strongest one being Austria recently, who is locking down those unvaccinated, and I read this morning Germany going towards the same path. France is taking away the free COVID testing system, so it's not free anymore to get tested, to ensure that people will not choose the testing solutions versus the vaccination solutions. And Austria also changes its path with a 2G rule nationwide, so meaning that either you have a recovery of COVID-19 or you're vaccinated to be accepted in public places. So many policies that have been emerged to try to push for this vaccination, which show some results. I mean, when we look at those green pass now to be able to move around national, internal to the countries, many countries in Europe took the solution of those green pass, so to move around for cinemas, restaurants, and even for work. I mean, Italy went to mandatory vaccination as well at workplace. And this has had some effect with regards to the vaccination coverage rate. So here are just numbers before and after the first policies were put in place for key countries. So it did increase a few weeks after the implementation of the policies, the uptake. Whether it was a sustained increase, that's not the case, but it did has an impact to create motivation. So just in terms of takeaways, as it is for vaccine hesitancy, it is multifactorial, it is complex. So how to actually act on in a short-term period, because we are in a pandemic, we are not dealing with a routine immunization here yet. It's really we have to deal with the pandemic. How you actually implement performance policies to ensure vaccination uptake is really complicated because of the contextual factors, epidemiological situations, the trust that the population has with institutions, how the vaccine has been communicated to the population. We've seen a lot of discrepancy as well between governments in the information delivered to the population, which did not help. And we see actually the policies by forcing and really forcing the population do the job because it's slow really entering in enforcement. But how this is actually being perceived by the population and what will be the impact on all vaccines in general and vaccination in general is not seen. So the Green Pass had a potential effect, but whether this is sustainable or not, this is a different question. Overall, the countries are reaching a size of plateau. So the countries that are performing well, the very well one is 100% nearly, so they are good. Those performing well, they are at 60, some 60, 65%, 75% of the adult population being covered, but it's really reaching a plateau, and they have difficulties to reach the remaining part of the population that still is in a mode of wait and see to get vaccinated. And interestingly enough, is really Portugal, Spain, and Ireland that managed to have really high vaccination coverage rates without resorting to any mandate at all. So this is the overview related to COVID-19 vaccination. I mean, I could have gone beyond all of this information, but I just wanted to focus to have happy to have open discussion afterwards. And then I just wanted to cover as well the impact of COVID-19 with regards to routine immunization. And it's important to remind that today in Europe, up to 20 infectious diseases and related cancers can be prevented through recommended routine vaccination. So routine being really what is recommended for defined eligible individuals at national or subnational level. So I'm not going to go through those 20 infectious diseases and related cancers that can be prevented through vaccination. But what is important to see is that vaccines cover all groups of age today across the lifespan, from pediatrics, adolescent, adults, and older adults. And when we look at the national recommendation across Europe, there is a huge discrepancy of what is publicly funded and provided to the population, with starting with 8 vaccines publicly funded in Romania, for instance, up to 18 vaccines publicly funded in Italy and Greece for the most comprehensive programs. So a huge difference in equity in access to vaccines preventable, to vaccines to be prevented, protected against vaccines preventable diseases. And when we look at what has happened over the last year, in fact, COVID-19 had a significant impact on the immunization programs, leading to a declining vaccination coverage rates. This has been seen globally and also at the regional level of Europe. And this was due to the social distancing that was created to really secure the population at home, but also the overloaded healthcare system where people didn't want to go to by fear of being infected. And it's estimated that at least 80 million of children did not actually get their vaccination for diphtheria, tetanus, measles, and polio, for instance, because of the disruption of the immunization program. And when we look at, so I'm just going to, because I'm not in full screen, so I'm going to put this out. What is going out with regards to Europe is 20% of the infants that have seen their vaccination interrupted. And this varies a lot again across the region. And the issue is that for not all countries, we actually have timely data. So we lack of report data. We have issues in having the clear picture of what this is all about. In Italy, just to give examples, 1 in 3 children postponed vaccination, and the less than 2 years was the most affected. Overall, there has been a % decrease in immunization coverage rates. 36 European member states actually seen a significant drop, over 5% in their routine immunization coverage rates, all in antigens combined. And we've seen also the coverage rates of measles going below the 95 coverage target. And this is also for countries like Italy, Denmark, Lithuania, Romania. So quite worrying, because not to forget that before the COVID-19 pandemic, we were in a measles outbreak. So why are we here? I mean, when we look at looking at timely monitoring for DTP, for example, in children, the first map doesn't actually show that we don't have necessarily a timely monitoring for every countries in the world, and this is even worse beyond pediatrics. And when we look at what the ECDC managed to do for tracking COVID-19 situation and the timely monitoring that we do have on the vaccination coverage rates across the region, this is just tremendous, because it does give the member states the ability to act, to assess where they are at, and to act in a timely manner. The 75% of coverage rates for a full course of COVID-19 vaccination in 9 months has never been achieved for influenza with decades of policies. So it's just to show that data can be massively supportive with regards to ensuring uptake. And why we don't have those data, I think it's also important to mention that we have an issue with regards to investment in the immunization programs in the region. Almost 80% of the European countries spend less than 0.5% of their healthcare budget on immunization. This represents less than €5 per capita, in fact, invested in immunization. So this is really important to acknowledge, because when we see what is the potential in terms of protection of the population, in terms of quantity of disease that can be prevented and for which the population can be protected, if you don't invest in the right infrastructures, in the education of your healthcare providers, in ensuring convenient access to your population, and in having continuous work related to building trust and confidence within your population, I mean, you cannot have a performant immunization system. So lack of investment across Europe is a critical issue. And these have short and long-term consequences. We've seen the difficulties in maintaining the routine immunization during a pandemic, which is clearly a factor of lack of resilience of the immunization system across Europe. We've seen there is gaps and delay in the rollout of COVID-19 adult vaccination, and in fact, it just demonstrates that no countries were ready to launch very quickly an adult immunization program campaign, because although the programs are very ready for pediatrics, they are lagging with regards to readiness for adult immunization. And it does delay the access to novel vaccines as well, this lack of investment. Just to give some figures, is for new vaccines to enter the market can take in a median time 6 years in Europe. So 6 years from a market, vaccines that has actually market authorization to reach a market, which is 3 times what you would get for a treatment. And this is even too long, honestly. So issues in access to novel vaccines. And what do we need to achieve? There is a lot with regards to vaccines preventable diseases. Before we were in the age of eliminating measles from the region, and this has been completely locked down, I think, or we completely lost the ground. Before, I repeat, COVID-19 pandemic, we were in a measles outbreak because of the issue of vaccines hesitancy. and we now are far from the elimination target. We have a plan worldwide to defeat meningitis by 2030. I mean, there is a visionary goals by the WHO in that regard. We have today a cancer plan for Europe, which call for elimination of HPV-related cancers, as well as prevention of hepatitis B-related cancers, for which there is also an elimination plan behind. And we are just right now in the new annual, I would say, influenza seasons, for which we should not lose track. So as Vaccines Europe, we launched a campaign with regards to the importance of implementing rightly the influenza vaccination campaign for this season. And we are very, very active in that regard. I'm really glad to say that I had my flu shot last week, by the way. So all of that is what we want to achieve is really to ensure that we can have a Europe free of vaccines preventable diseases. And sorry, I'll put this here. And in terms of call to actions, and I will pause here after that, just to summarize, because what we've seen for COVID-19 vaccination and its implementation is just demonstrating where the immunization programs, immunization policies in Europe is at. We really need to prioritize routine immunization as an essential service across the life course. So the fact that countries were not ready to implement an adult immunization program just demonstrates that there is no life course approach to vaccination embedded in the immunization policies of those countries. So ensuring that we move away from vaccines or for kids only to vaccines are there to protect the population at all stages of life is an important step to move forward. Improving access to routine immunization services through expanded delivery services. This is related to convenience in access. So vaccination should be available and adapted to the population. So pediatricians, I would summarize a bit like this. Schools, when the kids are bigger potentially, or where it is convenient for reaching the kids and the adolescents. For the adult active population, make it easy for pharmacists, community pharmacists, for instance, or depending on how the country is organized, but make it easy for an working adult to access vaccination, access through work potentially, and for the older adults, taking into consideration also their chronic conditions potentially. I mean, it's everybody within the healthcare system, every healthcare professional should be eligible to vaccinate their patients, and the patient should not have to go in a complex way through within the healthcare system to have access to vaccination. The vaccines should come to him fairly easy. So no silos within the healthcare system to who should be able to provide those vaccinations is important. Strengthening immunization data system is related to timely monitoring. Here is really important to have the infrastructure to collect the data and to ensure the timely monitoring of those data, but at national level, but also at regional level, the connection between member states and ECDC, for instance, is really important because viruses have no borders. So what is happening at a country level is not without a consequence for the other countries' neighborhood, the region, but it's global because viruses have no borders. So immunization data, strengthening the immunization data system is critical, and ensuring member states, EU institutions collaboration is really important. Continuous investment in building trust and confidence in vaccination. I will keep repeating it, but this is also very, very important. And last but not the least is ensuring financing for vaccination programs, because this is what we would say in French, the nerf de la guerre, where you really need to have those fundings capable to invest in the infrastructure of your systems to deliver adequately and in a convenient way the vaccination, to ensure the training of your healthcare providers and build trust and confidence of the population. And on those notes, I will pause here. Thank you very much. I'm happy to answer to any question.
Thank you so much, Sibilia, for this complete overview regarding the COVID-19 vaccination in Europe and in general, regarding the challenges and a lot of opportunities in general for vaccination in Europe. And indeed, I think the pandemic should be a catalyst also for the vaccination field, as you mentioned. As well, you mentioned the inequalities in terms of I will not say access to COVID-19 vaccines, but acceptance from the general population of the vaccine. We have countries, and you mentioned the Central Eastern European special situation, and we'll discuss the case with Dr. Gheorghita later on. But we have also champions in terms of vaccination and for COVID-19. And Israel is one of the countries who performed very well. It's actually the first country who started the vaccination, a large-scale vaccination campaign. Is the country who first recommended the third dose for the general population. So now it's my pleasure to invite Mr. David Saranga, the ambassador of the State of Israel to Romania, to actually explain the situation in Israel, the success of the COVID-19 vaccination campaign, lesson learned, and especially how do you see the future?
Thank you very much, Dr. Geanta. I know that my time is limited,
yes.
So I'll try and focus on some things that I'm not sure that everyone is aware of when it comes to our campaign. And especially, I would like to focus on the campaign itself and how we succeeded to convince the people. I mean, always we have these three categories. We have the people who are in favor, we have the people who are against, but in the middle, we have the people who are either hesitant or we have to push them. With the people who are pro-vaccination, there is nothing to do, just to bring to their awareness the existence of the vaccination, that they need to get vaccinated. People who are against, it's very difficult to convince them. But there is a big part of people in the middle to whom we should address our efforts. And I would like to focus on this group, what Israel did in order to convince this group of people who are either hesitant or it's not in their priority to go and to get vaccinated. In order to understand the way we acted, people have to know that the Israeli society is combined, I would say, of different tribes. When I say different tribes, I don't mean tribes that you see in the desert, but I mean big groups of ethnicities or big group of segments or demographics. And to each demographics, we had to speak in their own language and to address or to find what are the challenges of this group and to talk to them in their language. When I say to talk to them in their language, I mean first literally, because in Israel there are people speaking Arabic and so, or Russian or Amharic, which is the Ethiopian, the language spoken in Ethiopia. But not only that, we had to understand where they get the information from. And I'll bring some examples how we convey the message to different demographics. For example, the ultra-Orthodox community. In Israel, around 20% are ultra-Orthodox people. They have no internet because of religious reasons. They are not connected to the internet. They have no television at home. It's forbidden for them to have television at home. They don't listen to the radio. And if they listen to the radio, they listen to few specific stations. In other words, it's very difficult to reach this population through the electronic media. So we identified where they get the information from. For example, one of the ways to convey the message in this society is by putting posters on the walls in the neighborhoods. And knowing that I know that it sounds very primitive or it sounds very simple, but this is what the Israeli Ministry of Health did. We printed posters and we put them on the different walls in the neighborhoods where they live in order to bring it to their attention, in order to convince them. Another way is flyers in the synagogues. So the government printed flyers and put them in the synagogues from where they could get this information. Another way is to go with cars and the loudspeakers and to inform them about the vaccination centers, when they are open, and so on and so forth. So this is when it comes to the ultra-Orthodox. And of course, another way is by convincing their spiritual leaders. I mean, when we are speaking, usually when we speak about the ultra-Orthodox, it's not one group. There are many rabbis with different opinions, with different approach. Part of them are more open, others are more modern. It varies. But we identified these rabbis or these spiritual leaders with whom we could have a dialogue, and through them, or after convincing them, we succeeded to reach the big part of this community. To tell you that we succeeded, that we 100% succeeded among the ultra-Orthodox, no, there is still room to do. But I can assure you that we did much more than without this campaign. Another group, another segment in Israel are the Arabs. And when I'm talking about the Israeli Arabs, I'm not talking about the Palestinians, I'm talking about the Israeli Arabs, citizens of Israel. They don't trust the authorities. They don't trust the authorities in general, and especially they don't trust the Israeli authorities. And we had to go and to identify who are the gatekeepers when it comes to information there, and try and convince them. We have another group of the Bedouins, which are tribes living in the south of Israel. And the problem there is that every family, for example, has 10 or 12 kids. And if the mother, for example, wants to go and to get vaccinated, there is no one who will take care of the 12 kids in the village where she lives. So what we did, we established a kind of mobile units who arrived to the villages in order to vaccinate the people in these remote places. It cost us a lot of money, it's true, but we still believe that it's a kind of an investment, and it's much more costly or expensive to treat someone who is sick rather than to reach every community and every person with this mobile unit. Another way, or another thing which we did, we established at the Ministry of Health a kind of a media war room. In this war room, or a situation room, we detected all the fake news which appeared on social media, mainly on social media. And we tried to tackle, and we tried to find solutions to these different groups. If we're talking about groups of anti-vaccination people, or if we're talking about any other fake news. And one of the things that we monitored are the arguments of, especially the arguments of some doctors, or not necessarily doctors, who were anti-vaccination, because the moment we could identify what are the arguments they are using, we could prepare the answer to these arguments and to contra-argument these messages in order, and as I said, especially in order to reach the people who are hesitant. Because this is the group we had to, we found as a group that we have to tackle. Now, regarding the future, first, no one knows. I can tell you that around 50% of the Israelis are already vaccinated with the third dose, and around 90%, 89 to 90% of the population is vaccinated with the first and the second dose. The numbers are not enough. I mean, 50% of the population with the third dose, it's not enough, and we saw and we shared with the Romanian side this data. We saw that after 4 or 5 months, the effectiveness of the vaccine, and in Israel we vaccinated only with Pfizer, we saw that the effectiveness goes drastically down. Last week, exactly a week ago, Israel, or the special committee at the Ministry of Health in Israel, approved vaccinating kids between 5 and 11, at the age of at this age group between 5 and 11, and we are planning to start vaccinating them next week. We are waiting to get the doses from Pfizer, and we will start the process next week. Here, the Israeli Ministry of Health recommended people or families to vaccinate their kids. I'm not sure it's going to be as easy as it was before, because of 2 reasons. First, we're talking about kids, and second, since we already passed the 4th wave, and since the situation right now, the COVID is very good in Israel. We have every day only a few hundred cases. So people don't run and vaccinate the kids. I assume it will change if, God forbid, we'll see again that the numbers are going to increase. That's it for now.
Thank you so much, Ambassador David Saranga, for sharing your your lessons from Israel, and especially this approach of personalized and targeted communication with the target groups. And you are in the position to be able actually to identify, to stratify the population and to identify the right groups. What are the influencers? What are the spiritual leaders? What influence the behavior of a certain citizen? And I think very important, what is the source of information for them? And you mentioned that the poster on the synagogue and flyers. This indeed is something on the digital age, is something that we don't have top of our minds, but this was of very big help for you, for your campaign in Israel. Thank you for being with us today. Thank you once again for all these lessons. And now we are moving from Israel to Romania, and it is my pleasure to invite Dr. Valeriu Gheorghita, who is the head of COVID-19 vaccination campaign in Romania. Dr. Gheorghita, the floor is yours.
Good afternoon, everyone. Dear Ambassador, Your Excellency, dear colleagues, I am very honored to be here today, and I want to thank you for this meeting and for the invitation. I will make a short briefing about the vaccination campaign in Romania. We started on 27 on December 2020, in the same time with the other European countries. Until this moment, we vaccinated with at least 1 dose more than 7.5 million people, and more than 7 million people are fully vaccinated. What means that is around 47% of vaccination rate in adult population, and around 39% of vaccination rate from total population in Romania. Already we started since 28th of September this year the booster dose, and until this moment we already used more than 1.2 million doses. More than 60% of those people are from vulnerable group, are elderly people and chronic patients with chronic diseases, and the others are from healthcare and social staff, and also the person who are eligible for the booster, and there are all people that received with at least 6 months ago full vaccination. Of course, in this moment, we have around 23,000 new person a day that receive the vaccines. And we hope to maintain this vaccination rate on the future in order to achieve at least 50% of our population vaccinated until the end of the year. And we hope in the next year at the beginning to achieve at least 70% of our population. But what I would like to say about the willingness of our population to get the vaccine, the COVID-19 vaccine, as very well the Ambassador David Saranga already said, it is true also for Romania. We have 3 different groups of population. The population who were convinced to get the vaccine, and it was very easy to get them and to deliver offer the vaccines at the beginning of the vaccination campaign. And maybe you know that until March 2021, we were in the first places in Europe with the vaccination rate. But we have also another important segment of our population who are hesitant or are totally disinterested about vaccination. And of course, we have the last group, which is anti-vaxxer group. They are very strong, they are very well organized, and they have very strong messages in the public space in our country. And unfortunately, some of them are coming from politicians, some of them are coming from the medical staff, some of them are from the church representatives, and this was another very important problem in Romania, because we are an Orthodox country. More than 85% of our population are Orthodox, and the last research, social research that have been done during October this year showed that around 40% of our population are will in this moment to take the vaccines, but around 50% are totally convinced that they do not get the vaccines in the future. So the percentage of the population who are anti-vaxxer was increasing in the last time, unfortunately. And of course, those patients who are hesitant in this moment, they say that do not have enough information about what vaccines, what are the ingredients for the into the vaccines, and the other information about the adverse reactions, about the benefits, the importance of the vaccination. But in the same time, 80% of that patients are convinced that their natural immunity are enough to fight against COVID-19. So they do not think that the vaccine really adds some benefits in prevention of the diseases or or even severe diseases. But what we have to do in this moment, because we have in this moment, and we hope to finish very soon, the political instability. We change 4 Ministry of Health in 11 months this year, so it was very, very difficult. We have a history background in our country regarding vaccination program. In last 10 years, the vaccination hesitancy increased very much in Romania, especially in immunization program during lifetime, during adult period. In childhood vaccination program, the vaccination rate is still good, acceptable. But I remember that at the beginning of the pandemic, we were in a measles epidemics in Romania and other Eastern European countries because of low vaccination rate in children. So another reason maybe is related to the lack of trust in authority, and this lack of trust have been growing from many years ago, and the politicians in general have the lowest the population have the lowest confidence in politicians in general. So all the messages that are coming from the political side are not very credible, and of course many people are thinking if it is the right message or not. Another reason is about education, because unfortunately, we do not have a very strong prevention program in Romania, and we are not educated in the spirit of prevention. We do not invest budget in the prevention program in Romania. As already told you, in the childhood vaccination program, there is acceptable vaccination rate, but during adult period, the vaccination rate also for seasonal flu is very low. Also in healthcare staff. Another problem is that explain this huge hesitancy is maybe related to the absence of a strong support from the church, because unfortunately there were some individual cases that were very strong against vaccination, and they were very well known in the public. Of course, some part of our population, especially in northeastern part of the country, are very religious. They are practicants. They go to the church, and of course, when you find out some controversies in the church regarding the vaccination that are dangerous, are not very well studied, are not safe, and so on, and nobody take the responsibility for the vaccination. Of course, many people become hesitant. And it is true that the percent of the patient of the population who are in this moment against vaccination, very strong, was increasing in last month. I want to add another thing, that we want to involve more family doctors, more general practitioners in the vaccination process. In this moment, around 50% of them are directly involved in the vaccination process. And we want to find out what are the other reasons that the rest of the general practitioners do not want to be involved until this moment, and we hope to change this perception in the near future. We collaborate in this moment with some international organization, with WHO experts, with ACDC experts, and also UNICEF, mostly to build a communication and information strategy which have to target some specific population group, as Ambassador David Saranga said, because we do not have specific messages for specific group of population. We have common messages for vaccination, to support vaccination, that explained scientifically what are the benefits of the vaccination in terms of prevention of hospitalization beds and so on. But it's really very important to focus on vulnerable population, especially elderly people, because in people more than 80 years old, the percent of the vaccination is still very low, is around 24%. And we have a huge problem there, because most of them are living in rural area, and we have to get them maybe by involving the family doctors to have a phone interview with them, by involving the nurse, the community nurse. And also we want to develop some mobile units for information that should go there and to talk with people. And the last but not least, the collaboration with the local authorities is very, very important, because around 50% of our population are living in rural community, and it's very hard to avoid the collaboration with local authorities in order to implement in a good way the vaccination campaign. And some of them do not collaborate very well. Some of them were anti-vaxxers, and some of them, from the political reasons, do not really want to be with us in this process. And we try to involve influencers. Some of them did a very good job, but the others, due to the hate, because they have to face a very aggressive behavior from the anti-vaxxer sides. They failed. They didn't want to be involved in order to support the vaccination process. And also some doctors have been very, very strong for vaccination also in the publics, but they were very very well trained in the public communication. But the others, due to the fear of the hate, they renounced to be in this fight. It is very difficult. It is very difficult, and it seems to be a common problem of Eastern European countries, not only to the Romania. Maybe it's about history, it's about communism, I don't know, it's about trust, of course, but it's very hard to reach the good vaccination rate without other measures apart from communication. For sure is very important, and what we already seen in other European countries, after the 50–60%, it was very hard to increase the vaccination rate without other measures, without the Green Pass implementation. And for sure, it is mandatory that in Romania to be implemented in the near future the Green Pass, but I am afraid that our politicians, they will not be able to implement the Green Pass because of losing the popularity, and this is the truth. And I hope that they will be more involved in this process, and they will understand that it's critical for Romanian population to implement, to adopt the Green Pass in order to stimulate the vaccination rate. Thank you, and I am so sorry if we spend more time.
No worries. Thank you so much for all the data you provided. We have as well some questions for you, but we'll take all the questions later on. Indeed, all the current opinion polls shows that it's quite impossible to reach the 50% target vaccination of the general population without other measures. This is clear. And you mentioned the lack of prevention culture, and I think it's something very important. And as well, I think it's very important in general, before the pandemic, low access to healthcare for a lot of population. And you mentioned the rural areas, and indeed, the elderly people living in the small villages, they currently have no access to the healthcare. So it will be like a miracle to have access to the COVID-19 vaccination. But for them, we should be able somehow to invent a way to convince them to vaccinate. Thank you once again. As I mentioned, we have some questions, but we will have some time later on. And now we are moving to United Kingdom. And it's my pleasure to invite Lucio Fumi, who is the CEO of Piramal Enterprises, as I mentioned, from the United Kingdom, another country that I think it's a model in terms of vaccination for COVID-19, but as well for the way the UK is doing the genomic surveillance of the virus. So Lucio, the floor is yours.
Thank you very much, Marius. Can you hear me properly?
Yes. Yeah.
Well, I'm very conscious of the time, and I had some slides, but I'll give up my slides. I'll just say two things because I realize that the time is very limited. I want to thank you, especially the ambassador, because of what he said. I think he said something extremely important. The identification of different tribes and the importance to speak their language. I think it's an incredibly important thing to do. And you certainly implemented that as Israeli government. To this, I would think that it's important to add another point, the consistency and the credibility of the message. And this is where my predecessor, the Professor Gheorghita, mentioned just before me. The consistency of the message and the seriousness of the message is extremely important. I have no doubt that the Israeli government has a very high level of credibility and had a very consistent message, which is not necessarily true about the United Kingdom. There is this myth that the United Kingdom did very well during the pandemic. It's not true. Israel did very well during the pandemic, not the United Kingdom. The United Kingdom did well some things and did very badly other things. Now, the two photographs I wanted to show you in my slides are two photographs of top politicians. One is a photograph of Leo Varadkar. Leo Varadkar was the Prime Minister of the Republic of Ireland. In March last year, March of 2020, at the beginning of the pandemic, Leo Varadkar, who trained as a doctor, decided to go back to hospital and diffused a photograph of himself with a white coat and the goggles for the pandemic. Now, I don't know how many days Leo Varadkar spent in a hospital, probably just one day, probably just for that photograph. Maybe not, maybe he worked really with patients for a month, but that was a very positive message. The other photograph I had in my slides was a photograph of the Prime Minister of the United Kingdom, Boris Johnson, and it was very different. It was a photograph of the person who points the finger to the listener, said the rules are for you, the plebs. Okay, now I don't want to make. Oh, thank you very much. How do I go ahead? Thank you very much. How do I move on from here?
We will change the slides, Lucio.
Yeah.
Andre?
Can you go ahead? Can you go to the last slides? Do you mind? Is anybody? Yeah, thank you very much. Again. Yeah, okay. If you can go back to two slides. Yes, okay. Well, the first one is the one before this is Leo Varadkar. If you can go back one slide. Thank you very much. For some reason, I don't seem to be able to move. Share. Oh, no, sorry. Sorry about that. Sorry about that.
Lucio, there is on the screen.
Can you see them?
Yeah.
There is on the screen already.
All right. Okay. I can't see them, but doesn't matter. Okay. Okay. This is Leo Varadkar. Okay. This is a very positive message. If you go to the next slide, please. Yeah, this is not a positive message, okay? Of course, Boris Johnson never said those things. However, he does these things. Every time he goes to a hospital, does not wear a mask, for example, okay? In spite of being asked to wear a mask by all doctors. Now, he does that with everything, and I don't want this to be a political message. However, the consistency of the message from the government is extremely important. If you can go back now, I have a couple of slides just to show you back again, please. That's okay. This is the 12th of November. Okay, this is quite recent, and as you can see, it's not mystery that the UK that started very well. The UK started very well the process of vaccination. Number one, by developing the AstraZeneca vaccine very early in 2020. Now we know very well that AstraZeneca is perhaps not the best of the vaccines. Has a lower immunity, lower immunity levels. However, it was developed very quickly. And also it started reasonably very well the process of vaccination at the beginning of the year, or already in December last year. However, things went down because of lack of credibility, to the point that now we are, the UK is lagging very well behind many other countries. If you can go back one slide, and I apologize for doing that. Yeah, you can see this is important. We talk about first doses and second doses. Now, this is what we knew some years ago, okay? Unfortunately, months ago. So now we know that even the second dose, even if it is Pfizer, does the immunity caused by Pfizer, by the Pfizer vaccination, even by the second dose, wanes with time, and the booster is incredibly important. Again, the ambassador did say very clearly that Israel started the booster program already at the beginning of the summer. And now I believe we reached 50%. Now we must enter into the frame of mind that it's only with the booster that we can talk about fully vaccinated people, because the Green Pass already in Europe is released to everybody who has the two, the first dose and the second dose. However, it should be given as soon as practically possible to the people who had the third dose. And another thing that we must remember is that this thing, this COVID-19, this pandemic, is here to stay, very sadly. At the beginning, in February and March last year, we thought it would be a matter of 6 months. It wasn't a matter of 6 months. Now it's a year and a half, and it will possibly last, certainly 2 years, like the Spanish flu. But the Spanish flu, and it's still a very good example, even if it's 100-year-old. The Spanish flu lasted with a cauda, with a tail of 7 or 8 years. And with COVID, it will probably be exactly the same. So the message here is very clear. And I'll stop here with this, that we need the booster. And after that, we will need a vaccination, another booster every year for a certain number of years. And this is certainly a message also for Sibilia and for everybody around this panel, because this is going to become a chronic problem. And it's only with a very strong message, with a consistent message, that we can win this war. Thank you very much. I stop here.
Thank you so much, Lucio, and especially for your your message that the pandemic is here to stay, and I think we should all have this in mind when we discuss and act in this area as well. Thank you for your, let's say, predictions regarding the need for vaccination every year. I think it's very important to reframe the vaccination narrative. And we have seen situation in some countries with people that are vaccinated and in lockdown now. And this is the situation. We might face the situation next year for people who are vaccinated with the third dose and then infected and might need some more monoclonal antibodies or oral therapy. And all this actually medical reality should change the narratives around vaccination and should help us to deliver the right message. As well, thank you for highlighting again, as also Dr. Gheorghita did, these political determinants of health. Usually we are looking to the social determinants of health, economic, behavior, and so on. But the pandemic actually showed that how important are the politicians and how important is the politics. Thank you once again, Lucio, for highlighting all of this. Now we are moving forward with 2 or 3 Romanian frontline doctors from the day one fighting the pandemic in the hospital. And now it's my pleasure to invite the first of them, Associate-Professor Simin Florescu, who is as well General Manager of Victor Babeș Hospital in Bucharest, in Romania.
Hello, thank you. Good afternoon, and thank you for your invitation to this very important symposium and with very nice people around and important people. I have the opportunity to talk about the COVID vaccination from the hospital point of view. My hospital, Victor Babeș Hospital from Bucharest, is a hospital with a very flexible structure during this pandemic. Because we have between 490 and 610 beds, all of them dedicated to COVID patients starting from March 2020. Since March in 2020, we had more than 16,000 patients and around 400 patients in the ICU, all of them with COVID. Starting from February this year, 2021, we were expecting around with the starting of the vaccination campaign in Romania, you are expecting a decrease of COVID cases, especially in the risk groups, people more than 65 years of age, people with comorbidities, and also medical personnel. And at that time, we saw that we had enough amount of vaccines and we have people that wanted to get vaccinated, and it was a real rush for getting an appointment for vaccination at that time. And we have had big expectations about this in Romania. But after the vaccine became available to everyone without a fixed appointment, and the rise of fake news and vaccine hesitancy in the Romanian population, the rate of vaccination reached a plateau and then began to decrease. What was the outcome on us in the hospital? We saw an increasing number of severe and critical cases of COVID simultaneously with the 4th wave of pandemic. And in people, and these cases were in people that we were expecting to have been already vaccinated, people from risk groups, from the priority risk groups. We saw an increased mortality also in these patients. For example, in the hospital, we had 65% mortality in the ICU patients. And this was due to severe and critical cases, very late presented in the hospital. They were were brought to the hospital by the ambulances after 10 days of disease, at the last part of disease. Also, we had at least more 50% of them, of the critical cases and severe cases, that were referred from our hospital to other hospitals because our ICU was fully occupied almost, I think, 3 months already. And I want to highlight that more than 95% of critical and severe cases from our patients were involving unvaccinated patients. I had a very large number of questions during this time about the about the severe and critical cases in vaccinated people, and I told everyone the reality that 95% of these severe and critical cases were in unvaccinated people. This is a reality. So what we are doing besides treating these patients, because treating these patients is our main job, but what we are doing beside this to support the campaign, to support the vaccination, to support the people in our country. We try to educate families. We try to educate friends of the families and of the patients. And we are trying to make them accept the vaccination. It is a very hard thing to do because first of all, most of them are already infected from that patients, and second, because most of them belong to that groups, the hesitancy groups or even anti-vaxxer groups, and it's almost impossible to educate an anti-vaxxer to accept vaccination. This is what we saw, and there are very bizarre situations in the hospital when people need oxygen and they are refusing oxygen due to the fake news. When people need all kind of intensive care therapy and they are refusing, or families are trying to get the patients out from the hospital directly from ICU in a very critical state. And we are also convincing, besides the families and the personnel, even the medical personnel, because as you know, the medical personnel are composed also from hesitant people, even if they are working in a first line hospital for COVID. And after 27th of December 2020, when we started the vaccination in our medical personnel, we were vaccinated around 50-60% from the personnel. We convinced almost all of them during the next months, and now we reached around 97% of our personnel being vaccinated. And also, for doing this very smoothly, we have a vaccination center in our hospital, and we are trying to convince more and more people from the families and friends of the patients and from the families and friends of our personnel to get vaccinated. Because despite the fact that the number of cases is decreasing in Romania, the number of severe cases and critical cases are still very high, even in our hospital, and this is due to the unvaccinated people that are an important and large number still. And this is the point of view of infectious disease specialist. Thank you very much.
Thank you so much, Dr. Florescu. I think it's impressive to reach 97% of your personnel being vaccinated, and starting actually from a large part of them being hesitant. And the other, I think, important idea is that you organize part of the hospital a vaccination center, and this is one of the ideas highlighted by Sibilia at the beginning of our meeting, actually to make vaccines available and to be close to the people that actually need or want to be vaccinated. And now we are moving, I think, 2 or 3 kilometers from the Victor Babeș Hospital to the Floreasca Hospital. And it's my pleasure to invite our next speaker, Dr.Radu Tincu, who is the coordinator of the intensive care unit at the Floreasca Hospital in Bucharest.
Good afternoon. Thank you for introduction. It is a great pleasure to be here to discuss about the vaccination in Romania and the evolution of this process in our country. Unfortunately, we don't have a very good rate of vaccination, and we have a variety of reasons that produce this reality. after at least 2 years of pandemic, we still have refusal to see the COVID-19 as a threat. Unfortunately, they consider it a very easy disease, and almost of these people we can be recovered without any intervention. They have concerns about the vaccine side effects and a little trust, unfortunately, in vaccine or in institution behind them. They believe in at least one of the several different conspiracy theories, unfortunately. And here in the eastern part of the Europe, beside this reason, we have one more, the mystical and religious reason. So I think that the church must be involved in the vaccination campaign, because only the church will work with the same message, and the church can explain and eliminate these theories and this message from the public from the public space. Unfortunately, it will be very difficult to convince people to be vaccinated, because we have a lack of medical education during these 30 years after the revolution, and we don't have any prevention programs promoted by the Ministry of Health. But we must work together to inform people, and we must choose to deliver the message like an open dialogue, and we must to look for the two-way conversation, being respectful with these people and accepting and recognizing their concern. And in absence of this medical education and in absence of these preventive programs, I think the Green Pass must be adopted by the politician, because we need compulsory measure in order to correct this lack of vaccination. And this reduced vaccination rate in this last wave increased the pressure on the critical care. And we know all together that in the critical care, we have a lot of problems here in Romania with the deficit of the personnel, all the infrastructure of medical building that can't permit extension with more additional critical care beds, deficits for the critical care bed in some part of the country. The intensity of this last wave caused an inadequate response, medical response, that reduce the access to the medical services for the patient, for the non-COVID patient, because in the high rate of infection, we use half of the critical care capacity only to treat the COVID patient, and all other patients must use the rest, the half critical care. It was very difficult for some hospital to extend the critical care capacity, and it was very difficult to implement the functional circuit to split the two areas, the COVID area from the non-COVID area. So I think in the future we must focus on three topics. One is the communication, and this communication must be performed by the professional, not by the politician, because the lack of confidence in the politician will transfer on the vaccination campaign. The next one is to put all together on the table the church. We must to involve the church in this campaign to eliminate the mystical and religious fears. And another one is to adopt the Green Pass in order to increase the vaccination rate. Thank you.
Thank you so much, Dr. Tincu, for all the suggestions actually you provided. I think we have 6 more minutes from our session already extended. And we have some questions, and I'll actually ask you, Dr. Tincu, because there is an ongoing discussion about the doctors who are against vaccination, and the topic was addressed by many speakers today. What's your opinion regarding the measures that should be taken by the Romanian College of Physicians or professional societies in this regard. You as a physician.
Yeah.
What?
Yes.
Yeah.
Yeah, it was very dangerous way because these medical doctors presented in the public space will increase the disorientating of the people and will increase the fears. So I think two points of view must be implemented in the future. One is about the television. I think the regulation for the television must exclude this kind or type of message from the doctors, and another one it will be from the professional organizer. The medical organizer must implement some regulation, because it will, I think, for a doctor to discuss against vaccination, it against to the professional to be doctor. It's not logical to be a doctor and promote the anti-vaccination message. And unfortunately, these few doctors that appear in the public space, unfortunately, they are all together not involved in the pandemics, because one of these doctors is an ophthalmologist and the other is a plastic surgeon. They don't have any idea how to treat the patient with COVID disease, and they don't meet in these 2 years any patient with COVID diagnostic. So I think they must be eliminated from the public space, because the people can't understand why some doctors promote the anti-vaccine message.
Thank you. And we have some questions for, as I mentioned, for Dr. Gheorghita. One of them, I think the answer is clear. Have you had meetings in Romania with the Orthodox Church leaders? The answer is yes. I know many times,
yes,
even before
times.
the start of the vaccination campaign last year.
Yes, and after that, after we started vaccination campaign, we had I think 3 or 4 meetings with representatives of the 18 religious movement in Romania. I can say, for instance, that of course the Orthodox Church, their messages, on the official messages, were pro-vaccination, but they never told frankly people go for vaccination. They never do that. But on the other side, some priests were very, very strong against vaccination publicly, and this was very, very bad for the confidence in the vaccination benefits. But I can say that for Muslim, for Jewish, they were very, very strong for vaccination, and they were vaccinated in this moment in higher percentage. For instance, the Jewish community in Romania are vaccinated in 90% of their community. We had some meetings with the local representatives. We had question and answer meetings, but this was very important, that they were very interested to find out the answer of their hesitancy. They wanted to know what are the benefits, what are the side effects, what they have to get the vaccines, and so on, because we had a lot of messages in the public space, but it's very important to be interested in hearing that messages, to be interested about vaccination, and to understand that really the COVID-19 is a huge problem of this moment, and especially for Romania, and not only for Romania. And because of COVID-19, in each day, many hundreds of deaths are coming in Romania. So it's not acceptable to be normal situation like that. we have to somehow to aware the population, because is in our power, is in our hand to change this situation.
You mentioned the Jewish community in Romania, who is vaccinated in a higher percentage than the average Romanian population. And I actually had in mind the Romanian communities from other countries like Italy or Spain, where the vaccination rate actually is lower than the rate is in general in Spain. So it's a matter of, I think, of culture, and it's something we should address. There is another question, but I think you already answered on these. Vaccination campaigns started very well. Why the situation decreased in your opinion due to political situation? You mentioned already that. Poor messages campaign, I think, are the incomplete messages campaign.
Yes,
not
maybe
so poor,
incomplete,
because some messages were very good for different populations. And was as well another question regarding the fight of the authorities against the fake news. I think this is per se a discussion on how to best deal with the fake news, and especially on social media with social networks and so on. I think now it's time to stop. I'll try to say that now we are in a different position than we were 1 year ago. We have a lot of vaccines. We are waiting also for the second generation of vaccines. We have already billions of people vaccinated and billions of doses. I think there is no question regarding the efficacy and efficiency of the vaccines. I think the safety profile, it's a very good one and very important. It's a predictable one. So I think the questions people should have about the vaccinations are not about the vaccine, are about something else, and we should be able to identify what, and then to be able to engage with them and to have a proper and personalized communication. Thank you all for this very, very good session. Thank you once again, Krista, for inviting me, and now come back to you.
Thank you very much,
everybody.
And we will see in 30 minutes. It's lunch break, but we shorten because this subject it is a really hot one, and we had to discuss intensively. So thank you one more time, and we are seeing each other here on 30 minutes. Thank you.